Your colonoscopy came back fine, and your GI still ordered an MRI. Here's what they're actually looking for. Hi, I'm Kate, and today we're talking about MRIs, what they show, why your specialist ordered it, and why that decision makes complete sense once you understand what a colonoscopy simply cannot see. Because confusion about imaging turns into anxiety, and you don't need that on top of everything else. Now, this is my own family's experience. This moment that we got an MRI order for my son, we didn't understand why, because it had a colonoscopy. And my husband's pre-surgery imaging, we'd had scopes, but we also had an MRI, and that showed things that had been missed on the scope. And the question I hear most from patients when they call the clinic after getting the order is, why? Why am I getting this done when I've already had a colonoscopy and they're saying they can see Crohn's disease? Well, here's the thing that changes everything. A colonoscopy is a surface tool. It is extraordinarily good at what it does. It shows your GI the lining of your bowel, and that matters enormously. But Crohn's is not just a surface disease. A 2020 review in the journal Inflammatory Bowel Diseases confirmed that MRI detect transhumeral inflammation, meaning full thickness bowel wall involvement, with sensitivity comparable to surgical findings. And it maps disease in the small bowel that a colonoscope can never physically reach. Your GI didn't order this because something is wrong with your scope. They ordered it because they want to have the whole picture. And obviously, that is what we all want. So, transmural inflammation, so the full wall. An MRI shows inflammation through all layers of the bowel wall, not just the inner surface the scope can see. Now, think of it like an iceberg sticking out of the ocean. A scope can see the tip of the iceberg, but we don't know what's underneath. And that's what the MRI shows. It shows through all the layers, or it shows the whole iceberg underneath. Therefore, we can see what's going on, and we can see whether there's further danger ahead as a result of having that full picture. It also can identify the depth and behavior of strictures. So MRE distinguishes whether a narrowing is active inflammation or fibrous scarring, which completely changes the treatment decision of your doctor. So my husband's strictures imaging showed before his surgery that those things were fibrous, not active inflammation, and that changes everything. It also can show fistula tracks, where they go, from the bowel through surrounding tissue to wherever it ends, so the full picture. The scope can't follow that. It can just show you, oh, here's the side of a fistula, but you don't know where it's going and you don't know where it ends. So a patient or family can see the missing piece of the puzzle for the fistula, and that's important when we have talked about previously treatment for that. It can also look at the fat and lymph nodes surrounding the bowel. It shows Crohn's activity in these areas on an MRI. It's invisible on a scope. So the creeping fat term, that's what we call it. It also shows disease above the terminal ileum. A colonoscope reaches the very end of the small bowel at best, but the MRE maps the entire small intestine, all 6 meters of it, if you still have all of it left. So my son's imaging showed where his disease was sitting that the scope couldn't confirm. So it felt like, I guess, you've got more clarity. You can make a better decision when you've got the full map in front of you. You've got your scope results and what can be seen on that, and then you've also got the MRI results, which you can see exactly what's going on there. So the difference between those two things is enormous. Patients who come to me understanding that versus those who are still frightened by it. And once I understand the importance of having the full picture, everything changes. MRE is not a verdict, though. It's just a navigation tool, and having more information is always better. If you want a plain language summary of this, you can ask me for a guide and I'll send it. Just put a comment below and I will get it to you. And if this video helped the imaging order make sense, then share it with someone who just got theirs. Hi, I'm Kate, and I'll see you in the next video. Have a beautiful day.